Throughout the millennia, bacterial infections of minor wounds often resulted in death. Even 100 years ago, minor cuts could quickly become life-threatening, and serious bacterial illnesses such as meningitis, pneumonia, typhoid, syphilis, and gonorrhea had no effective treatment. World War I provided cruel evidence of the danger of bacteria, as many soldiers, surrounded by bacteria in the muddy trenches, died from otherwise survivable wounds. The need for an antibacterial breakthrough grew increasingly obvious. Sir Alexander Fleming discovered an antibacterial mold product, now known as penicillin, by chance in 1928 at St. Mary's Hospital in London. Fleming, who had been a battlefront doctor during World War I, left some culture plates of disease-causing bacteria sitting on a laboratory bench for an extended period of time. When preparing to send the culture plates for cleaning, he noticed mold had grown in a petri dish, intriguingly affecting the surrounding bacteria. Fleming had seen something extraordinary, a mold later identified as Penicillium notatum that prevented the growth of and even killed a wide range of bacteria. This accidental discovery would prove monumental in the treatment of bacterial infections. Fleming and his collaborators realized the importance of this finding and tried to isolate and identify the specific mold compound killing the bacteria, but their efforts failed. Fellow British scientist Howard Florey, like Fleming and many others, also investigated antibiotic compounds during the 1930s. Working with Ernst Chain at Oxford University, Florey tried to isolate the antibacterial compound produced by a strain derived from Fleming's Penicillium culture. Because of scientific advances and perhaps some luck, the Florey Chain team quickly identified how to purify penicillin without its immediate disappearance. Starting in 1939 and prompted by their nation's involvement in World War II, British scientists raced to find a way to increase penicillin production. The German blitzkrieg and bombing of London made it nearly impossible to obtain the specialized equipment and production facilities needed for large-scale penicillin production. The team started growing the mold in whatever containers they had available: bedpans, bathtubs, tin cans, and anything they could spare. Penicillin accumulated when the mold grew on specialized broth in these containers. They managed to produce only a small amount that they converted to a dry yellow powder. Animal tests soon showed penicillin was deadly to disease bacteria without harming the patient, a finding that prompted the use of penicillin to treat human infections.